overview of the STARS program that Medicare has and puts in front of us. And when it comes to the first question that I'm usually asked is, what is the Medicare STARS program? What is the CMS STARS program? And why? Why do they use it? And kind of have alluded to it, but the biggest piece of this is, of course, to improve outcomes. Patient outcomes are very important. And the HEDIS/STARS measures that CMS puts out there put a premium on prevention of disease and identifying disease before it becomes in a state where there's not much that can be done with it. So it's usually cancer screenings to identify and find cancers before a patient may have symptoms. So colonoscopies fall into the STARS program. So do mammograms. Also, monitoring A1Cs and blood glucose are very important pieces of the STARS program. And what it really does is it takes these different clinical pearls and clinical data points and ensures that something is being done for the patients prior to them having symptoms. And the other piece of this is also member satisfaction. It's very important. They ask patients, they do surveys on patients to identify how long do they wait before they see a doctor? Are they getting calls back if they make a phone call to a physician and make an appointment? So there are different categories that fall into this STARS program. One of them is staying healthy, managing chronic disease, member satisfaction, customer service. When it comes to customer service, remember your front desk, your office, that's customer service. Are they being greeted with a smile? That's a question that CMS asks patients. Are they getting phone calls back? Even plan operations. So they even ask about how a health plan's operations are. If they call because they want to benefit, are they getting phone call back, and are they getting closure to what they need? And then how is it calculated? Of course, there's a very complex piece, and there's weighted measures, there's aggregate scores, but the biggest piece of this is each measure that there is, and we have the measures towards the end of this, but every measure that there is, you have to do your best to try to meet these measures. Now, there are points and places that the measure doesn't actually contribute to the rating. Hypothetically, let's say if it's a mammogram screening, but the patient already has had cancer or has cancer currently, that member wouldn't be put into this calculation. But the key things is quality standards, member experience and satisfaction, and of course, Part D in terms of pharmacy and drugs.
Before I got into fee for value, I used to hear and see this, and it sounded very theoretical to me, because it's like, what doctor actually has the time to find out this information? So how do you, that's what you do, right?
Yeah, so what we do is we it depends on the relationship we have with the physician, but let's say you're working with us. The first thing we would do is we would do a lot of data mining. We would basically, let's just start with a small sample size. Let's say you have 100 members that are in Medicare Advantage plans. We would look at those records and we would dig through those records, and we built a system that we're able to develop a 1 or 2 page tool that you can use when you're seeing your patients. So that way you don't have to worry about, oh man, did I do this? Did I do that? Did I do this? We would put this form in front of you. We would give you this tool that you could use that would be able to help you know what Mary Smith needs, what screenings Mary Smith needs, what measures Mary Smith is missing on. If the blood pressure wasn't controlled on last visit, you would see that. So that way you have your EMR that you can use, but you would have a tool that will help you. So that way you don't have to go digging through your EMR and remember, oh, this is the measure, this is the measure, this measure needs to be met. We basically would give you a 1-page type of tool that would be able to help you ensure that Mary Smith gets everything that she needs.
So another question. Well, I'm using Practice Fusion, and it tells me that it can do my HEDIS scores. How much should I rely on that?
So Practice Fusion can't really do your HEDIS scores. Most EMRs can't do much. They may be able to tell you that these are measures, but they won't be able to tell you that the patient has already had it done, or some measures you don't need every year, you need them every 2 years. So Practice Fusion may tell you every year you have to do something when in reality you don't. So the ideal way to do this would be letting you take care of your patient, do what you have to, and be able to honestly data mine, dig through whatever you have done on the patient, what has been done at other places too. You don't know what has been done by specialists. So if we're able to identify all of these things have been done, and then based on claims and different data sets and different data points, we know that these 3 things need to be done on this visit. if you're able to knock those 3 things out in this visit, number 1, you achieve your 5 stars for that patient, but also more importantly, the patient gets what they need, gets the care they need, and you can focus on the other needs, because as we know, as all of us know, when a patient comes to see us, they have their own agenda that they come in with, their own questions, their own things. They want X, Y, and Z refilled. They're not worried about getting a colonoscopy. They usually are trying to shy away from it. So this will help you focus on what you need to get done for the patient, that the patient doesn't even realize they need to get done. Because remember, the patient comes to you and patients only come and see us when they need something, when they want something. They try to avoid those doctor's appointments. So when they do come in front of us, we want to make sure we get everything done that we can.
So in short, that is what an MSO does. As part of the channel, as we're educating docs, one of the questions that docs have, and docs are like everybody else, they don't always want to demonstrate what they don't know. So mention MSO and they'll say, oh yeah. And sometimes they don't know what an MSO is or what it does. Managed Services Organization. Now there's a legal term that has to do with some other stuff we won't deal with today. But in fee for value, MSOs do exactly what you're talking about. You do the data. The MSO does the data mining. It finds out what you need to know in terms of HEDIS, CAPS, HOS, all of the other things that matter. Medicare's watching you. And if you don't have the same kind of information watching your own practice, you're in a world of hurt. So again, that's what we're all about. If you have an interest in talking with us, I'm just going to put an unabashed plug for us. Call us at 859-721-1414. That's 859-721-1414 and ask for Michelle or Jesus. So any other comments before we get to the next topics?
I think the most important part of this whole idea behind why CMS put this into place was to, number 1, help ensure patients get these screenings, but also whenever you're buying something on Amazon, most people will look at the reviews. So this is a way a patient, when they're looking for a physician, are able to look at reviews, and they get different star ratings. So each physician, everyone listening to this, if you are a physician, if you're a provider, you have a star rating from CMS. Do you know what your star rating is? If you look and you see you're a 1-star, 2-star, and let's say the provider down the street is a 4-star or 5-star, and if you're Michael looking for a new doctor, are you going to pick the 1-star or 2-star? Or are you going to pick the 4-star or 5-star? It's just like us when we're trying to buy something. So the same way, you are providing a service. The idea behind these ratings is to show these different patients all over the nation which providers are doing what CMS is requiring them, and patients don't know what these star ratings are based on. They think these star ratings are just based on how good of a doctor you are. And does it mean a 2-star or 3-star provider is a bad doctor, or does it just mean they don't understand the HEDIS/star measures when it comes to Medicare Advantage plans?
So I'm working with a public company right now. They've let their stars slip to 3.5 and they're on their way digging back up. But as you said, this is not just CMS. It's critical in terms of CMS because they're your payer, but it's also critical in terms of your patients. So that's it for 5-star. As we've mentioned, it's public. It's right out there for patients as well as your payers. It's ranked. There are bonuses and incentives that your payment is based on it. Patients choose primary care providers with higher quality scores. Involves prevention, monitoring, and management. That's what an MSO does. That's what we do. Again, if you have interest in working with us, give us a call at 859-721-1414. So in the next video, we'll talk a little bit about HEDIS.